This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Welcome, everybody, to another episode of PHM from Pittsburgh. I am still your host, Dr. Tony Tarchichi. I'm a med-peds trained pediatric hospitalist here at UPMC Children's Hospital of Pittsburgh at the Paul C. Gaffney Division of Pediatric Hospital Medicine. Now, if you're new here, welcome, and if you're a regular listener, welcome back. We've been coming to you since October of 2016, discussing continuing medical education topics. And we decided to try to do something very challenging for me, is to figure out how to cover the research part of the ABP's content specifications, ABP being the American Board of Pediatrics. How do we cover what you have to know to critically evaluate the literature in an audio-only podcast format? As you can imagine, this is challenging. And to pull it off, we have partnered with our colleagues at Dell Children's Medical Center and here at the University of Pittsburgh, shout out to Dr. Philana Ling Lin, and a group of experts clearly from both institutions, University of Texas at Austin and the University of Pittsburgh. And you're going to meet them throughout this series, and we really couldn't have done this without all of their help. If you've listened to this podcast ever at all, you know I am not a statistics expert, and this is something that we needed expert opinion on. And one of the experts is here with us today, friend of the podcast now, Dr. Jenna Carlson, to help us out one more time with regression, linear and logistic and survival analysis. This is episode 12 if you're keeping track. In case this is your first one you're listening to, Dr. Jenna Carlson is an assistant professor of human genetics and biostatistics in the School of Public Health at the University of Pittsburgh. She received her Ph.D. in biostatistics from Pitt in 2017 and completed postdoctoral training in human genetics in 2018, where she joined the faculty of Pitt Public Health. She's an expert in statistical genetics, focusing on genetic epidemiology, studies of complex traits. Dr. Carlson also has a passion for statistics education. She teaches several courses in Pitt Public Health, as well as our programming workshops throughout the health sciences library system. So, Dr. Carlson, thank you so much for joining us again.
Thanks so much for having me. I'm excited to be here.
Well, Jenna, we'll do our usual disclosure statements before these episodes. I will go first and kick it out to you. I was a part of the Sanofi Corporation's advisory board on increasing vaccination rates in immunocompromised patients, which should have no bearing on what we're talking about today.
And I have nothing to disclose.
So, Jenna, as usual, I am not the most helpful for these particular topics. Normally, I try to be helpful, but can you help us with why regression, linear and logistic and survival analysis is important for us to know in order to critically evaluate clinical literature for our patients?
Sure, no problem. Let me start by what regression is at a high level and why we use it at all in statistics. So regression at its basic is a way of modeling statistical association between some predictor variables or independent variables and an outcome variable or a dependent variable. And why we need this is because the basic statistics that you have usually work for analyzing the relationship between two variables only. Is there a difference in the proportion of hospital admissions between these two protocols? Yes or no? Two variables we're looking at there. Regression has a framework to put in more variables into your model. So maybe is there a difference in hospital admission rates for these two treatment groups after we account for the age of the patient or the severity of their injury or anything like that? So it's a way of building a model that accounts for lots of different variables, but still gives you a statistical measure of association between some variable or variables of interest and an outcome.
So if I understood that correctly, and correct me if I am wrong, please, is if you can look at multiple different variables, but it allows you to account for multiple different variables while you're really looking for the association between two.
Sure. You can look for the association between several, but it does allow one of the ways you can use regression is to control for or adjust in a statistical sense for some other variables that you know might be important to your outcome that may or may not be your primary interest, but you know that you want to include an adjustment for them.
So if I could try to shoot a clinical example, and you tell me if this makes sense for regression, if I want to look at how much in-house smoking affects the prevalence of pediatric asthma, but other important variables here would be, does the patient have eczema? Is there a lot of air pollution where they live? All of these other things I'd have to account for. Regression would be a way to account for them and then look at all of their relevance to pediatric asthma, or single one or two out individually. Is that right?
Yes, exactly. And from a statistical and epidemiological perspective, ideally what we want to have when we're trying to determine causal association, like does in-house smoking cause for higher rates of asthma or cause asthma, is the gold standard would be some kind of randomized trial. But obviously that's not applicable or possible in many situations because of ethics or feasibility. And so here's a great example of when you cannot randomize children to be in a household that has smokers in it. So we have to use kind of our next best pieces of information. And one of the ways that you can do that is by adjusting for those other types of covariates in a statistical model in regression. Exactly like you said.
Well, that is fantastic. So now can you walk us through what linear and logistic and survival analysis means in regards to this?
Yeah, exactly. Before we do that, though, I do want to point out, like in my hierarchy of statistical benefit, that regression can account for things as covariate, but it doesn't perfectly do that. It does that in kind of like an on average, I'm adjusting for this kind of way. It's still not going to give you a perfectly causal effect at the end of it because it is limited in its statistical wizardry, but it is a way of accounting for other important variables. So I'll just give that caveat there. Well, it's not going to get you out of the woods there.
In episode 11, this is such a great throwback, because in episode 11, it was measurement of association and effect, correlation and causation, and we talked about that a bit, about how randomized controlled trials are the gold standard for causation, but others can be used for correlation. And I'm going to butcher this, the Brandon Hicks or Brandon Hill model for figuring causation, or what you should look for to really assign causation to a topic.
Right, exactly. So this is just one tool when randomization isn't a possibility. You can use these kind of statistical adjustments to get better at what might be a causal effect, but it doesn't prove causality. You would need all those other pieces.
This is fantastic. All right, great.
Awesome. Okay, so what are the different types of regression? We've got linear and logistic. Let's talk about those two just for a second. And there's a lot of differences when you go under the hood and get into the really nitty-gritty math thing, but we're not going to do that here. That's not the purpose of this podcast. Right. And definitely not going to be rattling off equations at everybody for an audio podcast.
In an audio format. I don't know.
Yeah, that would be miserable. So the primary difference is let's think about what our outcome variable is. For linear regression, we think that our outcome variable ought to be continuous and pretty symmetrically distributed. So something like a normal distribution will be great. Linear regression, continuous variable outcome. Logistic regression is when you have a binary or dichotomous variable. So this is really often used for diseases or conditions that have a yes-no categorization.
Okay, so like our asthma question, yes or no?
Yes, exactly. Predicting the rates of asthma would be a logistic regression question because the outcome is a yes-no. You can have any types of predictor variables to predict that, but because the outcome is a dichotomous variable, you would use logistic regression.
Okay, so an example for linear, if I had to pick something, if you were looking at the height someone can jump, how high they can jump, and you did like specific training exercises and seeing if one was more likely to increase their vertical, there your end point is how high someone can jump. These are continuous variables, 2 feet, 3 feet, 4 feet, etc. So that would be, and it should have a standard distribution that would be linear. And then logistic is more of a yes, no, have the disease or not.
Yes, exactly. Yeah, so it all goes back to how the variable is classified. And I mean, you can see models that go together. Like oftentimes we'll use this when we're looking at diabetes or other metabolic conditions, is you've got some combo measures. You've got a fasting glucose, which is continuous.
Mm-hmm.
And then a good research paper would also look at a diabetes diagnosis. So depending on the population that you're looking at, you can use comparative models as a way of digging a little bit deeper into the data. So a linear model for glucose measure, and then a logistic model for a diabetes diagnosis. Both should get at some of the same important predictors or causal factors.
That's great. You can do them both at the same time. Okay.
Mm-hmm.
This is great. And then what about our last friend, survival analysis?
So survival analysis is a little bit different because the data is going to be set up a little bit differently. And I'm going to motivate this slightly differently. So it's when you have a continuous measure, but that measure is time related. So survival analysis is most often used in clinical trials to measure literally time until some event happens. Usually that event is death or cancer recurrence or some hard outcome. And the problem with that, you might think time, okay, that's continuous. I can measure that. No problem. And if you had that measure on absolutely everybody, you could just use linear regression. But what often happens is we don't follow everybody from birth until death. So we don't observe the events all happening within the course of our study. And that when that happens, you have something called censoring. Let me take an example of a trial where we're looking time until death from disease or something else. In that study, if you only follow everybody for 5 years, not everybody is going to die. Mm-hmm. And so you have some people who have their time variable is just however long the study was, 5 years. And they would have what's called a censored observation of like, we know that they will die eventually, but we don't know how long that time period actually will be. And that's when you need to use survival analysis because you have a continuous measure, but then some kind of censoring happening of I didn't actually observe the event in the time frame that I was studying the participants. This also really happens if you have people drop out of your study. So maybe somebody was part of this for the first 3 years and then they moved and you lost contact with them. What you know is that they were there for 3 years, so they didn't experience the event for 3 years, but then they were censored at that point. And survival analysis is just a statistical tool that can handle that kind of data, that keeps whatever information you have and then accounts for that censoring.
So survival analysis, if you're looking at someone or something over a long course of time, the best example is looking for death, but people drop out of the study, move, or the study will last a certain amount of time, you can censor their data, and that's how you use survival analysis to account for those people.
Yeah,
that is
exactly.
Fascinating.
Yeah. So if you're trying to classify this and come up with an easy way to remember the differences, linear regression is a continuous outcome. Logistic regression is a binary outcome. And survival analysis is a time to event outcome where not everybody experiences the event.
So can I ask a question? Because the survival analysis made me think of all the blue zone studies we are reading about in the news. This is places where people are living to over 100 years of age, and they're trying to account for why. And they talk about plant-based diet and exercise more. This is all examples of regression, I'm assuming, where they're looking at a population and they're trying to account for multiple variables as to why these people are living longer. And then they're coming up with some where there is a correlation and we're trying to figure out if it's a causation. But we can't do, to find out causation, it's ideal to do a randomized controlled trial, but you can't move people from birth and say, live here and let's see what happens to you. That's not ethical. Right. So you have to use these retrospective studies, and then this is where regression comes in handy. Is that correct?
Yeah. Regression is just that way of examining multiple predictors and their effect on the outcome. So that's a great example of it.
And in that example, years lived is a linear regression model, but then do they get cancer or not is a yes-no logistic. And then survival analysis would account for those who moved.
You could use survival analysis for those who moved, yeah. If you were measuring like if the outcome you're measuring is time until some event, so time until death, for example.
Okay, I think I got this, Jenna. Am I missing anything? Is there something more we should be covering that I'm not thinking of? But I just loved how you explained that because I think I really got it.
No, I think that's great. I think that's a good introduction to the different techniques, and There's obviously a lot more statistical nuance that I'd love to chat in detail with, but will not for the sake of the podcast.
This is what we call keeping them wanting more. You're going to have a lot of people enrolling in your class in biostats.
Whet the appetite just a little bit. Exactly.
Well, this has been great. We got it in 15 minutes. I mean, this is wonderful. Jenna, thank you so much for helping us with this.
Yeah, thanks for having me. Appreciate it.
Thank you for joining us for this Journal Club series at PHM from Pittsburgh. We want to especially thank our expert guest for their time.
Special thanks to the University of Pittsburgh for sponsoring the CME for this podcast, and UPMC Children's Hospital of Pittsburgh for supporting this podcast as well. We want to thank our friends at Dell Children's Medical Center and the University of Texas at Austin for their partnership on this endeavor.
Please email my dad at tony.tarchichi@chp.edu with any questions or comments. And as always, thank you for listening!